to this webinar. Yeah, I'm called Alison Adet Chinenjere, and I'm the chair of the Library and Information Science Technical Working Group under the African Forum for Research and Education in Health. The acronym is AfriHealth. For those of you who are not very familiar with AfriHealth, you can go to the website and find out more about AfriHealth. Yeah, so we have all in one way or the other been affected by the COVID-19 pandemic. And I believe most of us, or most of our institutions, have reopened after a lockdown in each of our countries, respectively. However, we have all had challenges of adopting to the new normal. So this webinar will discuss the challenges that have been encountered in libraries as we strive to reopen for operation. We hope that sharing experiences and learning and best practices will benefit us all, that is the users, the library users, and the librarians. So having said that, let me take this opportunity to present, to call upon the speakers to introduce themselves. Dr. Christine Kanyengo from University of Zambia has just sent her apologies. She lost a close relative and is not able to join us. But we have Miss Glorias Asiimwe. So Glorias Asiimwe, can you please briefly introduce yourself and you start? Share the screen and you start your presentation. Thank you.
Thank you. Thank you very much, Dr. Addison. I put on the video, I think you can see me there. My name is Glorias Asiimwe. I'm a librarian at Busitema University Faculty of Health Sciences. That's in Uganda, located in a place called Mbale. So I'll be switching off briefly the video cam so that my network doesn't keep cutting off. I hope that is okay with the members present. Thank you. So mainly this webinar that we are going to present, as Dr. Allison has already said, I was to present with Dr. Christine. However, she's not able to attend due to some challenges, but we are going to be looking at the challenges that we are facing of library users and even us library staff, with SOPs that we've set as libraries. So mainly this webinar, we are going to look at some of the library SOPs that we've set up. SOPs are standard operating procedures, the challenges of obeying these SOPs by library users and even us library staff. And it will be more interactive. We have to share our experiences of what's going on in our libraries, and then we can have a conclusion and a way forward. How can we go forth? So in a bit of introduction, we can see that as libraries, we've always been places like people who keep the information. We are stewards of the information. We have to support our institutions because without it, the library, that's why they say a good institution or a good university is as good as its library. And therefore, our role is very vital. And for this, people always come, the different users we serve, they come to the libraries. Some come to find information, some come to do their research. However, with COVID-19, the situation has changed in a way that we are still the stewards of information. We've not stopped. We are still supporting the education. However, for the gathering places where people come, the story is changing. And we have to adapt to the new normal. And this new normal is of seeing how do we shift from the more of the traditional way into the digital, having to offer our services online, using virtual services, like having these webinars that we're doing right now, and also supporting the online teaching. So as Dr. Allison said, most of the libraries have already reopened. Like here, I would give an example of Uganda. I think all of us now have opened. However, we'll hear from our colleagues from other countries how it is. But we've developed some standard operating systems. And here I'm giving just a few, but we shall share and add more. Like one of them is hand washing and sanitizing, then wearing of face masks when the users are coming to the library, having to maintain social distancing, and also requesting our users to stay at home if they're unwell with some of the flu, cough, or fever symptoms. And though we have set these standard operating systems, we have to really ask ourselves as librarians, as information workers, are these SOPs really obeyed by ourselves who have set them, and also for those users? That's a question that we really have to think about. And looking at those challenges that are happening, I'm going to cover one SOP after the other. So let's look at hand washing and sanitizing. We know that with this SOP, there has to be some finances available. You can't get the sanitizers for free. And also you need to buy the soap for hand washing and also the equipment. So we have to really think, do we have those budgets as the libraries? Because we see now with COVID, the attention is, we are getting more of the budget cuts. And even before that, libraries were most of those that were underfunded. I would give an example from my own institution. So do we really have the budget? And also when we put these hand washing equipment or facilities and sanitizers, where are they really located in our libraries? Are they at the entrance? And this entrance, because most of our libraries, you find that we are limited in terms of space. So if it's hand washing and the library is somewhere in the middle of the building, is it really accessible by all users? Then also the understaffing bit, like if we really are to keep a close eye, we have to ask ourselves, do we really have the staff who are going to constantly check that everyone has washed their hands, that they have sanitized? Because in the first place, we are really understaffed. And also looking from the user's point of view, are they really positive about these SOPs, or they think we are adding on another load to them? If I look at the SOP of ensuring wearing face masks while users come to the library, first of all, as our institutions, we have to look back and say, are our libraries able to provide face masks to every user? Is it really? Because that goes hand in hand with a budget. If it's not possible, can every user get their own face mask? But as we know that we are serving different users, maybe in the academic institutions, you find all sorts, the young ones, the mature ones. So some will come with excuses that they don't have a face mask. So what do we do in that case? And wearing a face mask, to be realistic, it takes a bit of getting used to. You find that you're going to put it on in the morning, and then maybe mid-afternoon, you're finding it's really hot, you're pulling it off. Even you who is trying to put up that SOP hanged somewhere at the entrance, you find you're also challenged in wearing that mask. So if you're not wearing it, how are you going to make sure that you're telling users, oh, kindly put on your masks, and you yourself, you're finding that challenge? Then also, when you're wearing masks, sometimes we've seen some funny stories on social media, like, you may mention one thing and the user gets in another way because the mask, they didn't hear you clearly. So we really have to put that into consideration. Otherwise, you find at the end of the day, we have to pull it a bit down, talk to someone, and there you don't know where you're getting infected from. And also, are these masks weared properly? Because if you do an assessment, even if people are doing on TV or they are in meetings, you'll always find the masks are pulled down, some are putting them halfway, others they're just on the ear. So can we say our users are going to be constantly putting them all covered on the face, like covering the eyes, mouth, and nose, or are they going to reach somewhere and they also do the same? Then also that social distancing, while we keep this social distancing or physical distancing, we really have to look at our library spaces. First of all, some of us, our libraries are very small, that even if we are to leave a seat in between, you'll find that you're going to be serving very few people. So in that case, are we going to chase away those who come and you have those middle gaps that you've left there? Or are we going to partition the library and say maybe this side people sit here, others don't, or when people come, you say, no, we are full, please come back later? Because that in another way could be how the users take the positivity that will come from the users on the libraries. And also saying when someone is feeling unwell or sick, we have to really ask ourselves, like, are we going to discriminate someone? Suppose I came to the library, I'm looking ill, or that's my appearance anyway, or I have some issues, or I have a condition, but it's not related to COVID. And I don't have these symptoms of cough, flu, but still I don't look well. Are we going to say, okay, for you, you enter, and for you, you stay out? But who is going to do that? That again comes to the staffing bit. Do we have the staff who's going to constantly say, you look like this, go back, you can enter? Then we have also to look at the issue of temperature guns for checking the abnormal temperatures. How many really in our libraries do have those? Personally speaking, at my library, I don't have it. So it's one where we could put it there as an SOP, but then ourselves, we find it a challenge enforcing it. And then if someone is not presenting those symptoms like flu, cough, but is unwell, actually, because like students we serve, someone may wake up and has been on the clinical wards, has seen patients, and you never know what they have caught from there. But someone still wants to come and do maybe their research, they're on a deadline. So how are we going to stop such a person? So with those in mind, with those of the challenges that I've mentioned and some of the issues that are happening with these SOPs, as Dr. Allison said, this is going to be more interactive. I'll call on you participants, those who are in attendance, kindly share your experiences of the SOPs you have developed. They may be more from what we have presented, but we'd like to hear from you what's happening. Thank you very much. And for now, I'm going to stop here and first hand over to Dr. Allison, then I'll come back later. Thank you.
Yes, thank you very much, Glorias. If you could stop sharing. Yeah, thank you very much, Glorias. By the way, I did not mention that Glorias is my mentee. I have mentored her for some time now. Thank you very much. I realize that the challenges are actually similar in my country, in Uganda. I don't have much comment, but I will just share some experience that I have observed. When the COVID-19 pandemic came and we had a lockdown, when we reopened, we were very, very serious. We had soap, we had sanitizers, we had temperature guns, and students and library users were actually putting on masks seriously. Then along the way, the numbers that were infecting, the infections went very low, they went down. People were no longer dying. At one point, we had no infections. We had like, I think 24 24 patients in hospital out of the very many that were there around, I think around April, around December. So what happened when the numbers went down, the death stopped, the infections reduced, our library users also relaxed. They relaxed, especially the students. They come with a mask, you know, someone comes with a mask in the pocket. As they are entering is when we ask, do you have a mask? Then the person picks the mask from the pocket. This means that where that person has been, if nobody asked, it means that he was there without masking. So you talk to them, they quickly pick the mask from their pockets, they put it on. When they pass the security area and enter the library and they sit, they now put their masks on the chins, they wear them on the chins. So you wonder, what is going to happen? Are these people really masking? And that is one of the challenges that Glorias has shared. I don't want to repeat it. And of course, the funds. And in my country, institutions are really constrained financially. So if they have sanitizers for 1 to 3 months, you may find that along the way, they don't have funds to procure more sanitizers, they don't have temperature guns, and it's a big challenge. But anyway, let me now call upon members to share experiences. Please put your hand up before you talk. Put your hand up, raise your hand, and then I'll select you and you give your experience. Thank you very much.
Hello.
And if you don't, yes, Walter.
Hello, thank you, members. Thank you, Gloria, for a very wonderful presentation. I want to share some experience, but before that, I want to tell members that in Uganda, specifically, the SOPs are coming like directive from Ministry of Health and then from the government, which I think everybody must adhere to that. The issue to do with the budgeting, which you talked about, is a challenge everywhere. In my place here, we are starting seeing now reduction into supply of sanitizers, and even now we check students, there's a lot of reductions, and the medical students seem to be, their attitude, I don't know how to call it, but they seem not to fear some of these. But what we are doing in the library is that our library here in Bulu University for Medical School seats about 100 students. So what we have done, we decided to remove half of the chairs so that we can accommodate only 50 at one go. And then we have put, we have temperature gun, we have sanitizer where students will sanitize themselves, the electronic sanitizer, that is better so that it's not contaminated. That is what we are trying to use. But still the challenge remains that people are continuing and avoiding SOPs, but we have also put on the wall these SOPs so that students can read and see the seriousness of the virus. The virus is still with us. We keep telling our students that please put on mask, social distance, and they have started following, but still the challenges remain. Thank you very much. Hello? Hello?
Thank you very much, Walter. Walter, thank you for sharing. Thank you for sharing your experience from Guru University in Uganda. Can we hear from someone outside Uganda? I actually don't see. Grace has left. Abigail, where are you from?
Malawi.
From Malawi. Can we please share your experiences from Malawi?
Yeah, I think when we had the first wave, we had put things in place, but I think there was a lack of monitoring. as the speaker said, either the student wear it and remove it when they are in the library, or it has to be demanded to say, do you have one? They wear it temporarily to pass through the gate, then they take it off. But when we had the second wave, we even intensified the efforts because we had we had some students who also got the infection. So they installed those electronic hand sanitizers, hand washing facilities. And comparing from the first wave to the second wave, things were better, but still, we still have some who would not wear. So I think it's something that I don't know how, what should happen, but the efforts have been made, but people are making choices now, whether to wash hands or whether to use the sanitizer and whether to have a mask all the time. So I think that's our challenge. And also even though there's a space, but people tend to crowd around some certain corners and stuff like that. Yeah.
Okay, thank you very much, Abigail from Malawi. Yes, as you can see, colleagues, challenges are almost similar in all the institutions. So it is really up to us, the librarians, to ensure that we adhere, first of all, and then we emphasize, we also implement, because we cannot implement when we are us ourselves are not wearing the masks the right way, or are not wearing them, and somehow we are not wearing them at all. Can we now hear from another person from outside Uganda? Sorry, I'm being selective because it looks like the Ugandans are quite many. They will all talk, but can I request? I don't see any other person. There was somebody look, she's not there anymore. Muhammad, can we hear from you? Musa from Busitema.
Okay, here in the University of Ibadan, we are very strict with maintaining the different COVID-19 protocols, using washing, hand washing, social distancing, and all the rest. But on our campus in the College of Medicine, every building, in each of the buildings, we have taps, even in departments. In front of each building, you find wash hand basins. And when you get to departments, you find the same thing, different designs of water with soap for those coming in to wash their hands. We have two in front of our library here. Washing of hand is compulsory. We have a security man in front of the library. If you don't wear your face mask, he wouldn't allow you to enter the library. And if you have to wash your hands before coming in. Now, users get into the library and then remove the mask. So they say they are tired. It's not easy wearing mask, especially when they have spaces in between each other. That it's not easy to wear the mask for an extended period of time, which is true. And then sometimes they want to discuss in group. And then you are telling them, no, you can't sit so close to each other. And then if you know you want to sit close to each other, because you want to discuss, you want to have a group discussion, then you have to wear the mask. If you are not interested in wearing the mask, then you have to leave, go to the educational garden. We have a garden in front of the library where that is not enclosed. So it's a garden. There's roof. Students can sit down there and then discuss. That has helped us. So many of the times they have to go out to discuss instead of discussing close together within the confines of the library. Another thing is that sometimes you see people who say they don't have face mask. So what we did is to buy face masks. If you don't have face mask, buy from us. We have face mask. It's the same thing they sell elsewhere. Buy and then you come in and use the library. So those are some of the things we do here in the College of Medicine, especially in the library. We insist that, but where I even have issues is with the library staff. They don't just want to get used to wearing the mask. Many of the time, the mask is in their chin. They are supposed to use it to cover their nose and their mouth, but it's in their chin. When they see a senior person coming, they put it on, and then when you turn your back, they put it out. They put it in their chin. Same with the users. So those are the issues. Now, the question that Glorias raised is very pertinent. For how long do we continue to buy? We didn't try to buy sanitizers for everyone. Initially, we tried, but we knew that it's not sustainable to be buying sanitizers. In our university library, our university librarian said they can't do water, put in taps because students will wet their hands and then use it to touch the library resources. So it is sanitizers on every floor, on every entrance. There are sanitizers and the automated type. Once you put your hands out, 1 or 2 drops enter your hands and then you use it and go in. But we cannot do that here in the medical library because it's just not sustainable. Even the soap, I don't know how far we can stretch it because the truth is that there's no money anywhere. There's no money. Money is scarce resource now in this time of COVID, everywhere. So let's see how far we can go with buying the hand washing soap. Those are issues. Thank you very much. That's my own contribution.
Okay, thank you, Grace, for your contribution. As I can see, yes, I already mentioned that actually the challenges are kind of similar, but the way we are mitigating these challenges, for example, at Ibadan, there's something that they are doing that we are not doing. Maybe we should try that. Buying masks and keeping them in the library so that when students come without masks, we tell them to buy. The government of Uganda actually bought masks for everyone. They were supposed to be given to everyone. Of course, some did not get, but and yet the budget was there, everything was there. We don't know what happened, but we expected the students, at least by the time we reopened, we expected everyone to have a mask written on government of Uganda. Very few of the students have those masks. So we really don't know what is happening. And then I have seen in the chat, if you look in the chat, Onen Walter just commented, said, put SOPs on the walls, control spacing, give long period, emphasize e-resources, improve ventilation. So those are some of the mitigation avenues for trying to prevent further spread and also to make sure that the library users adhere to those SOPs. Yeah, I also have a challenge maybe that I need to share. We actually put information on the wall as you're entering my library. On the glass door outside, there is a very big poster talking about COVID and the challenges and please wash your hands, please sanitize. But I don't know how many of our students read them. They just come in, they pass the notice, they don't read it, they enter with the mask in the pocket. So you wonder. So I think we still have a lot of work to do as librarians, and I think we can do it. I think that we can do it.
Yes, we can.
So, yes. So before I want to call upon others, but please remember that there is a message from the AfriHealth Secretariat in the chat. Thank you for your participation. Kindly follow this link to evaluate the webinar. So please make sure that you follow that link and you at least evaluate this webinar. And also what I would like to say is that the next one, we are going to have Grace Ajuwon do a workshop on Mendeley referencing tool. Please make sure that you do not miss that one. Now this is practical, this is academic. You know, these are SOPs, we are talking, sharing experiences, but the other one will be a practical session. We are yet to set the date, maybe next week, but we shall let you know. I didn't want to forget those, so let's continue. Gerasom, do you have anything to share? I'm sorry, I'm not waiting for your hands because I don't think we have much time. I'm just speaking on you. If you have something to share, you can put it in the chat or you can say something. Yes.
Yes, thanks very much, Doctor. What I have just realized that every we have same challenges, but as a librarians, we have to keep emphasizing, we have to remain on our point, and we put all those posts everywhere. And students, you know, students are very stubborn. Sometimes we talk and, you know, they pretend as if there is, you know, as if everything is fine, but we have to keep emphasizing. We have to keep telling them we should not lose morale. Thanks very much.
Okay.
Okay.
I have a question now, Sen. Are the students all fully back on campus at Makerere?
The students, right now, I think there is one most group that has not come, but
Okay.
most of the students are now here. They are now here. Even the freshers actually also have reported. But we started in phases. We started slowly. Then as the numbers increased, the SOPs were less adhered to.
Okay.
Yes.
Okay.
Yes.
For us, we are now in the first semester, and all the students are in their different locations. There is we don't have students on campus, all of them, both undergraduate and graduate students. They are all in their homes, receiving or doing online, receiving lectures online. So it is in the second semester that we'll have the students back. The only students that are right now in the Hall of Residence are the final year medical students. And the reason is that you cannot teach clinical, they can't do their clinical postings online. They have to be physically present in the wards, in the clinics. So they have to bring them in. And then now they are looking at how they can get the 500 level student also back in the hall. And for that to happen, a lot of money had to be spent to sanitize the halls of residence, to get a wash hand basins, to get the taps running, to put each one in a room, you know, and then make sure they all tested for COVID, and some of them tested positive. So these are some of the issues. And then even then, they don't have face-to-face lectures, apart from going to the wards and the clinic, and this they do in very small groups. They all still receive their lectures online. So right now, we don't really have much traffic in the libraries, except those residents writing exams, and then those PhD students who are on their research. Those are the ones we have currently using the library. Thank you.
Okay, thank you very much, Grace. Do we have any other comments? Do you have any comment from AfriHealth?
Maybe just to thank you for organizing this webinar. It was advertised a while, but I don't know why people have not attended. But I think we see a common pattern across most schools. Although there's no funding, but people have made some efforts to do something about it. But now what remains is an intervention to encourage people to follow the principles of COVID prevention. So I'm happy for the library group because at least you've come up with something, and it's something that is happening in almost all libraries. My librarian is attending a meeting. Maybe he would have more to say, but he's attending another meeting. So I think congratulations for the efforts, and please continue doing so. We'll continue to publicize so that other people attend. That's all I can say. Thank you.
Okay, thank you very much. And I also must say that we should really appreciate AfriHealth because they support us in setting up all this. Of course, we also put in our effort and do, but they are always there in the background, supporting us all through. Thank you very much. We have only 2 minutes. Can we please evaluate the webinar and then we close the session?
Yes.
Gloria, before we...
Yes,
Grace.
Dr. Allison.
Yes, I wanted to find out if you have any comment from the experiences that we have shared. Glorias.
Dr. Allison.
Okay, yes.
Yes, yes, we like the way participants were contributing. I also see from our own institution, like the challenges are the same. Some ideas, I think this was a planning where we shared about the masks, having them in a library. Maybe it could also be a source of income, an income generating activity, but also ensuring our security. And then also emphasizing that the emphasis we have to put there, and also I think I mentioned something. I just had one slide, I think, as a concluding slide. Then before they can go through the evaluation.
Okay, can you please share the slide very quickly?
Thank the AfriHealth for setting up the webinar. However, it is kind of...
I declare the webinar closed.
I greet everybody.
Thank
Have a
you.
good day.
I greet everybody.
Asante sana.
Asante,
Asante.
thank you.